Hello and welcome to our Patina Nation webinar. I'm your producer, Jesse Casperson, Community Manager at Patina. Before we get started, let's review some housekeeping items. Today's most important features are the chat tool and the Q&A tool. If you have any questions or comments for our speaker, simply use the Q&A tool. This is where we'll address all questions and comments that are submitted. Our speaker will address these as time allows, but if you have any questions, send those that way and you're welcome to respond to others. If you have any technical questions, please use the chat tool to communicate with our production team. And please do not use the chat tool to communicate with our speakers. At the top of your window, you'll find viewing options, which can change how you view today's presentation. Please note that all participants' microphones are muted for today's presentation. And if you haven't downloaded the Zoom platform and are using the browser version of Zoom, you may not have access to all of today's features. However, you should still be able to watch and listen. This event is being recorded. Watch for a replay in the coming days on patinanation.com. We're glad so many of you could join us today, and we'll kick off today's presentation. So thank you. Our goal here at Patina Nation is to make you the best and most successful independent executive you can be, whether you're working for yourself, working for Patina, or even working for one of our competitors. At Patina Nation, it's a community for you to learn, share, and network. And you can be an active and contributing member on Patina Nation through many different avenues. There's earning opportunities, learning and development opportunities, benefits for independent executives, business support services such as an IT help desk, Patina lifestyle offerings, and then marketing tools and resources. To learn more, visit patinanation.com. Now, onto today's presentation and speaker. Health eFilings is a healthcare IT company which offers healthcare organizations of all sizes an enterprise solution that enables them to effectively manage this transition while maximizing their Medicare reimbursements and bonuses. Its cloud-based ONC certified software enables clinicians to leverage the data in their HR and improve the quality of patient care, outcomes, optimize quality measures and performance, and improve their bottom line. Since the software fully automates the process and does all the work with no IT resources, no administrative support, and no workflow changes, clinicians have more time to focus on their patients. Health eFilings has partnered with Patina Solutions and is interested in Patina Nation professionals who are working to leverage their network to promote its services. By making introductions to senior level executives in the healthcare industry, you can earn a referral fee. Joining us today is Robert from Health eFilings, and I'll turn the event over to him.
Great. Thanks, Jesse, and good afternoon, everybody. We greatly appreciate the time and your willingness to participate and hear about Health eFilings and, importantly, how we might be able to work together to create some opportunities in the marketplace. So just quickly, our agenda today with the hour that we have together, we're just going to tell you initially a little bit about Health eFilings so you understand who we are, what we do, and how we fit into the market. We're going to spend some time talking about the changing healthcare landscape itself. We think it's really important that folks understand either what is happening in the market or what we expect to be happening in the market, and therefore why and how our services fit in and address a very critical need for healthcare organizations, whether big or small, in today's marketplace. And then importantly, we're going to talk about ways in which we think we can and would very much like to work with you as a partner to create appropriate introductions into your network where our services might very well be be a benefit to the folks that you know within the industry. So just quickly, a little bit about Healthy Filings. We are a healthcare IT company based in Madison, Wisconsin. So yes, we're right in the backyard of Epic, but we are not an Epic spin out, as many things in the Madison market tend to be these days. We are privately held, and as sort of the vernacular goes, we're a private equity backed entity as a privately held organization, but very well capitalized as a result of kind of what we've been doing and how we are in the marketplace. So our executive team, if you will, has extensive experience both relative to industry and startup. And so whereas we like to say we're 4 years young, if you will, as a company, between myself, our COO, and our director of engineering and so forth, we all have 20 plus years of experience across various industries and so forth. We're also not new to the structure of an early stage, high growth type of organization such as Healthy Filings. And as we said, we pursued this particular opportunity in the market because given the changing landscape of the healthcare industry, we saw a significant unmet need in the market that wasn't and couldn't be addressed by EHRs, wasn't being supported by other entities in the industry itself. And that's what we're going to talk a little bit more about today. So just at a high level, so you know who we're talking about, again, I'm Robert Hopton. I'm the CEO of the company. I myself have 20 plus years of general management experience, having run multi-billion-dollar operating divisions for Fortune 50 publicly traded companies, but I'm also not new to sort of the high growth, early stage company structure. Healthy Filings is my fourth entity that I've run as a CEO. Mike Weidler is our COO and CFO. He's a CPA with over 20 years of experience as well, and has also worked in these smaller, high growth, private equity backed type of company structures. So very familiar with what it takes to build the right infrastructure for us to be able to support, importantly, our clients. And then Jeff Schmitz is our head of engineering, very experienced and very competent, if you will, in this particular area. One of our board members as well was a senior executive at Epic Systems, so another grounding, if you will, in the healthcare industry. So we feel we've got the right team in place here to understand the market, but importantly, are bringing to market a critical service that addresses a need that has been unmet otherwise. And we're looking to fill that void, if you will, with your assistance in terms of getting us to the right folks in the organization. So what is going on in the healthcare industry and how could we be thinking about this? And importantly, where are Healthy Filings services kind of focused based on what's going on? Well, to make sure everybody is well grounded, our healthcare system is a very complicated one. No political stance being taken on that commentary at all, because these are just statement of facts, which is Medicare, which is a $7 trillion a year expense, is currently on a trajectory to be insolvent by 2026. Clearly, that's not something that anybody wants to have happen. Everybody is working hard to make sure it doesn't. But with the reality of it being that every day for the next 12 years, 10,000 people a day are coming of age and going on to Medicare, there need to be some changes in our healthcare system to address overall quality of care and how we can do that cost effectively. And as a result, laws are being put in place, and the ONC and CMS are the entities within our governing bodies that are on point for administering those laws, putting programs in place to assure things don't happen like Medicare going insolvent. And that's where we come in. That's where we've kind of built our platform to be able to assist healthcare organizations be able to address what they do, how they bill, and what their reimbursements ultimately are with and through the Medicare program. So what is happening here for those, again, just to get everybody grounded, there are laws in place. So the current law is referred to as MACRA. It was passed back in 2015, just so we're all very clear, this has absolutely nothing to do with the Affordable Care Act. So we got a lot of politics in Washington. Again, this isn't a political statement, but just to be very clear, what is or isn't being discussed in Washington around the Affordable Care Act, what may or may not happen to it with, and what may come down in the future, this is a separate and distinct law that has been passed, overwhelmingly bipartisanship here, because again, this is all about how do we avoid Medicare in particular from going insolvent, based on its current trajectory. So with that law in place, healthcare systems, big or small, have no choice but to comply with those laws. What they have to comply with are various programs that CMS establishes to basically administer the law. In this case, the current program in place is referred to as MIPS, the Merit-Based Incentive Payment System. This is a point-based system in which the more points you earn, the greater your reimbursements. But what's very unique about what's happening here is the previous laws and programs, organizations, healthcare organizations simply needed to comply in order to avoid penalty and potentially even earn some upside adjustments to their reimbursements. But the MIPS program is a competitive program. You earn points based on how well you do versus peers. And in this case, peers are meant from an absolute standpoint, and it doesn't necessarily mean specific specialty. It has nothing to do with whether you come from a large or a small healthcare system. You're competing against every other clinician that's submitting comparable data, and based on how well you do versus that peer set will determine points that you earn, and there's a direct correlation between points and reimbursements. And so what's happening now with this law and the program, the only way to push that initiative ahead very simply is to leverage technology. And so CMS in particular and the ONC are driving our healthcare infrastructure to use technology because there's a belief ultimately that technology will help to improve outcomes, be a more cost-effective way to operate our health system, and therefore we'll get better overall quality of care for, importantly, the patients and the consumers of our healthcare system. And so a term we're going to use throughout today's discussion is CERT, Certified EHR Technology. That is the technology platform that CMS is driving our health system to be on and, importantly, to use once on. Phase one of that was getting our healthcare system basically all up and running on EHRs, electronic health records, sometimes referred to as EMRs, electronic medical records. They're kind of one and the same. But ultimately, now that the health system is all, for the most part, using EHR as a means to capture critical patient data, the question is, what do we do to leverage that critical patient data to improve outcomes and do it more cost effectively? And so the other half of that technology equation are entities like eFilings. We too are classified as a CERT because we're using technology. See that as sort of synonymous with software as a means to enable the better access to analysis of and then utilization of the data that's in that EHR for purposes of achieving the objectives under the MACRA law. So what's at stake? What's at stake is pretty significant. Back to the comment that with these programs, you earn points, and based on the points you earn will determine your reimbursements. As you can see just from the graphic here, so forth, here in the 2019 reporting period, if a healthcare system does not comply or does not comply effectively with the MIPS program, they will see a 7% downward adjustment on their Medicare reimbursements for an entire year. Now, we won't get into a lot of the depth around sort of the margin structure for the healthcare system, but for those of you who have familiarity, you know that the margins are fairly thin with Medicare services. And so to take a 7% deduction, literally point for point deduction on your Medicare reimbursements for an entire year puts a pretty significant adverse impact on a healthcare organization or system's bottom line. So they can't afford to ignore not only the program, but how to most effectively earn points under the construct of the program. With that said, the law also put in place an opportunity for there to be upside for those that choose to actively engage and focus on improving the overall quality of care and doing that cost effectively, giving them a chance to earn points. The more points they earn, they could also see some upward adjustments called positive payment adjustments to their reimbursements as well. The law requires this to be a budget neutral program, and so for every dollar taken in the form of a penalty, it needs to be paid back out to those performers in the form of a positive payment adjustment. And based on the way the law works, they could theoretically see as much as a 21% increase in their reimbursements, based on how well they score versus how many did not score well or didn't comply properly with the program. Additionally, there's the opportunity for a 10% bonus on their total annual Medicare reimbursements based on becoming an exceptional performer. The law set up a $500 million a year bonus pool for the exceptional performers. And so again, the more points, the higher the probability that you can become an exceptional performer. And again, a 10% increase in your reimbursements is a pretty significant impact to the bottom line. So as you can see, the financial implications are quite significant. Those that are choosing to get out in front of and be proactive about understanding and then managing towards optimizing their performance under these programs are the ones who are going to succeed financially. But at the same time, there's a fundamental belief based on the way the law was constructed, it will also improve the quality of our healthcare overall, which is really at the very heart of the objectives of what's happening here with our healthcare system. So I also like to point this out, which is this is not static. Each year, the rules of the game, if you will, change. And each year, the implications of not competing effectively or not complying will increase relative to the downside implications. And so in 2018, the penalty downside was 5%. In 19, it's 7%. In 2020, at this point, they've already stated that it will go to 9%. So the bar is being raised each year in terms of A, points you need to earn, and B, if you don't earn sufficient points under the program, what the downside implications will be to an entire year of Medicare reimbursements. So we want people to think about and take this very seriously. This is where we come into play in terms of who we are and what value we can bring to a healthcare organization. Again, whether it's a small independent practice or a very large health system, they all need to comply with MACRA, the law, MIPS, the program, and earn points regardless of their size, regardless of their structure, regardless of their specialty, in order to impact their reimbursements, avoiding the downside and going after the upside. So what services do we offer and how do we structure those services? As I stated, Health eFilings is a certified EHR technology. That's critical because healthcare systems that use CERT for purposes of compliance are actually afforded quite a few benefits, such as bonus points towards their score, avoidance of audit risk, things of that sort. Why? Ultimately, the data integrity that comes from using a service like ours is something that the ONC and CMS is counting on for purposes of being able to know that it's valid data, that it's complete data, and therefore they can use that data to conduct the analysis, the assessment, and ultimately factor in the fee system that they're going to use for reimbursing clinicians on a go-forward basis. So how do we, Health eFilings, do this? We are a software company. Our business model is a traditional SaaS model, software as a service. We have a cloud-based software solution. Our software has been certified by the ONC. We go through an annual certification process for our software, quarterly reviews and attestations in order to maintain that certification, such as the things I'm about to tell you we do and that the way we do it has all been validated. So there's peace of mind and confidence for our customers that when they buy into using our service platform, that it will work the way we say that it will. Now, with that said, I referenced earlier EHRs. I referenced one of our key members of our team, spent 10 years with Epic, but we're Switzerland. As long as the EHR is a certified EHR, we can perform our services on behalf of that healthcare organization. To date, we've integrated with over 80 different EHRs for purposes of providing our services. And we have been able to integrate even with healthcare systems that are working on multiple EHRs in order to be able to bring that data all together for purposes of creating a single comprehensive patient record, which is what's required for purposes of being able to perform services and submit accurate data to CMS. And I guess just a little pat on the back here, we speak with confidence because in the years we've been doing this, we've had a 100% success rate relative to submitting data and files on behalf of our clients that have been accepted by CMS for purposes of being in compliance with the various programs. So we structure our service with sort of two elements to it. And we're going to do a demo of our web-based platform so you can see what the customer-facing element of the service is. Because again, as a cloud-based software solution, there's no software for them to download, no software for them to learn how to use. Essentially, the way it's working is we do a comprehensive data extraction. And through that data extraction, we bring all that data into our data warehouse for purposes of doing data analysis, measure calculation, measure sorting, and ultimately submitting the required data onto CMS. But we do have a customer-facing dashboard that will allow them to be proactive in their engagement relative to their performance throughout the year, so they have an opportunity to influence the outcome of their results rather than it just being a fait accompli for them. So, next slide. There we go. So, to be clear here with this, the way this works is, again, there's often this question that comes right up: how do you work with or what's the relationship, if you will, between what you do and what an EHR does? And so just to be clear, even though we fall under the same umbrella as what is CMS is set up as a classification as a CERT, we're not an EHR, we don't intend to be an EHR, but we work complementary and synergistically with an EHR to do what an EHR doesn't and isn't built to do. So even Epic and Cerner are the two largest EHRs in the market. We say with 100% confidence and certainty that they can't and don't perform the services we do on behalf of the healthcare organization for purposes of being able to comply with programs like MIPS. And so certain elements of the program are very critical, like being able to benchmark, because the benchmarking determines how you're doing relative to your peers and therefore points that you earn. The EHRs can't and don't benchmark, whereas we have built into our software platform the exact same database that CMS uses for purposes of determining that benchmarks. There are things known as quality measures. That's how providers are being held accountable for the standard of care and the type of care that they're providing. We, Healthy Filings, are certified for all of those quality measures. EHRs aren't. There are other elements of the program where, again, like the improvement activities and being able to have that interoperability of data across EHR platforms that even the big guys, EHR, Cerner, et cetera, won't be able to provide that benefit to their clients. That's where, again, we come in working complementary and synergistically with the EHR, but essentially what we're doing is we're leveraging the data within that EHR for purposes of tracking the healthcare systems and the providers within that healthcare system's performance relative to quality and delivering of quality care. So as I said with this, we're working synergistically to provide functionality that the EHR isn't set up to do, and ultimately the benefits to the clients here is they basically 1 + 1 = 3. They've got a certified EHR, they've got a certified service like Healthy Filings for purposes of being able to comply, and by doing so, they earn bonus points, they earn more points, and the net result is that they will see higher reimbursements as a result of that. So we're going to talk a little bit here for a couple of minutes relative to the platform we've branded called the QM Accelerator, which is our web-based dashboard, which is how our clients do interface with the service that we provide, and importantly, their ability to be proactive rather than reactive as to what will be submitted into CMS for purposes of being in compliance with the program, and importantly, earning more points. So hopefully what everyone is seeing right now is a screen that we've just flipped over to where we've got a mock health system called Healthy Filings Medical Center. With that, I'm going to take that, thank you. With that, this is our web-based dashboard. This dashboard can be accessed from anywhere on any platform, allowing the healthcare organization, if you will, to be able to track on an ongoing basis how they're doing relative to the critical quality measures that they have to report into CMS, and that CMS will determine how many points they earn, and therefore the correlation back to their reimbursements. I'm going to go through this at a high level. We're not going to get into a lot of the detail, but I want you to see the structure of it, and then importantly, some of the key functionality associated with it. So when a client logs into their version of the dashboard, this is what we call the hierarchy. This is determined by them. For larger health systems, they may want to set it up by clinic location, by department, whatever it might be. But we will set this up. As we set up front for our clients, there's no IT resources required. There's no administrative resources required because our team will do 100% of the setup, data extraction, updating the dashboard for the client's benefit. But so they'll tell us what the hierarchy is that they're looking for their organization to be able to track their performance. It's on this dashboard that they're able to track their performance for the measures, if you will, that are part of the MIPS program that they ultimately are required to report that data into. And so here you can see, again, just a couple examples of those quality measures, and we'll talk a little bit more about that in a minute. But just to give you an example, here's the hierarchy. So here's the overall organization. For this demonstration purposes, we have it set up at 4 locations. And then if you click there, what's going to come up is now you're going to see the next level down, which is every provider at that particular location. So ultimately, what we enable through this dashboard is the tracking for the healthcare organization as a whole, right down to every single clinician that's part of the healthcare organization. And you'll see then how we're able to track every single patient that's seen by every single provider within that healthcare organization. So that's kind of the hierarchy. Then within the core part of the platform here, and we just have 3 pulled up, all the different ECQMs that could be tracked. We track all of them on the dashboard. They may not all be relevant to every single healthcare practice, but those that are will appear on the dashboard at whatever level they are within the hierarchy. And so ultimately here, we're tracking the performance of each of those quality measures. Now, what's interesting here, just to point out, again, back to the whole idea of needing to compete versus just comply, here are 3 measures. Measures are numerator, denominator. So if a patient presents in a certain way, they end up in the denominator. If the clinician engages with them per the measure definition, they end up in the numerator. Obviously, you want the highest percentage possible. But your absolute score may not be what the determining factor is relative to which measures should be submitted in order to optimize your score. The benchmarking, which is what this rectangle is to the right, is what becomes critical to knowing which measures should be reported. So in this case, we have a measure that's almost at 70%. Some would think, okay, of these 3, that's what I should report. But that actually only falls into the 3rd decile, earning them only 3 out of the 10 possible points. So it would be the wrong measure in which to submit, whereas these other 2 measures put them into a higher decile based on benchmarking, and therefore those are the right measures. Our platform enables the visibility to this benchmarking. And as we said, the other EHRs, Cerner, Epic, et cetera, don't provide this type of benchmarking, and therefore it becomes important to stay very focused on how you're doing. But then the next level down here is great. We've got patients that are in the denominator, but they're not the numerator. What does that mean? And importantly, how does that information become actionable? So our platform is set up here by clicking this patients button. It will bring up every patient that was seen by that healthcare organization or provider, depending on what level you're at, and that falls into that measure definition. What becomes really important here, and I know I'm moving quickly here, is what we call the outliers. By clicking on the outliers, what that will bring up for the organization is every single patient that met the criteria of the denominator but wasn't in the numerator. And so this is where the opportunity is, right? The opportunity in this case is to understand who met the denominator criteria but not the numerator criteria, and what can or should be done relative to how one engages with the patient for purposes of then improving your overall performance, i.e. quality of care and improving outcomes, and therefore increasing your score. So if we then look now, we've got all those patients that weren't in the numerator. By clicking on the Y button, this brings up the detailed explanation for the measure itself, and will highlight what was met and what wasn't met. And so by doing so, that gives them the visibility as to what needs to be done for a particular patient in order to, again, deliver better overall care, but also improve their score correspondingly. Now, that's helpful. And so what that does, I'm sorry, actually, I will go back here. Click around here real quick. So with that ability to drill down right to the patient's individual patient level, the question becomes, what and how do we get overall visibility to that? Well, here we allow the functionality of a lot of different reports that we can run, again, based on the organization and what level of the organization we're looking at. One of them is the outliers report. That outliers report will bring up, for the measures that are on the dashboard, every single patient that was an outlier and which measures they were an outlier for, and therefore an ability to hyperlink back to their specific chart, their patient record, to be able to see through that visual what could or should be done for purposes of improving the overall score. So that becomes a very important and useful tool for a healthcare organization to be, again, proactive about what they can and should engage with the patients on a go-forward basis to improve the score. Another way, and a very useful tool, is what we call the clinician scorecard. This will then basically take the hierarchy of the organization, turn it on its side, and then by clicking on this, this will bring up every clinician identified within that location or that department and show what the individual clinician's performance is relative to those measures. And again, these are all hyperlinks back to the individual clinician and for that measure, and then all of their corresponding patients. So as you can see, with a couple quick clicks on the dashboard here, we're able to get down to a level of specificity for each provider, for every patient, for every relevant measure, how they're doing, what they're doing well, what needs to be focused on for improvement, and then specifically calling out what those improvements could and should be. So at a high level, that's essentially the way this web-based dashboard works. There's a lot more functionality where they can customize which measures they want to see by user, but all of this is done, set up for the healthcare organization based on their direction as to how they want to look at and track their organization. So with that, we're going to flip back to another screen here. Sorry, give us 1 minute here. All right, perfect. So hopefully everybody's looking at, great. So with that said, what's the opportunity here and what we're hoping to kind of accomplish with our very high level overview today, which is to basically introduce ourselves to you in hopes that this stimulates some thoughts, some ideas on who within your network might be a candidate for our service, and hopes that that might result in some introductions into your network for purposes of introducing our services. So the way we are looking at this is really sort of twofold, which is introductions come in the form of what we'll call a direct sale, an introduction right into a healthcare organization. Again, big or small, publicly traded, privately held, they all need to comply. And so a direct introduction would be more than appropriate. Or there may be introductions to other folks that you know, like people at an EHR. As we said, we work complementary and synergistically with an EHR, or consultants or other players in the healthcare space where the nature of our service would either be complementary to or easy for them to make an introduction into that organization. So from a direct sales standpoint, obviously the types of organizations we're looking for, we've been talking about this, these can be large health systems, they can be hospitals, outpatient clinics, skilled nursing facilities, specialty types of clinics. The specialty, the size, the location isn't what's relevant. If they are seeing patients that are on Medicare and they are billing Medicare for those services, then they need to comply with these programs. Otherwise, they will face, significant downside pressure relative to their reimbursements, and also importantly, foregoing some upside associated with that. So who within those organizations? Depending on the size of the organization, it could be the CMO, it could be the CFO, because there's a very strong impact to the bottom line of an organization. So going in through the financial department could be a way. Many of the larger, medium-sized organizations have quality departments or compliance departments, so introductions there. But ultimately, we're looking to get in front of key decision makers who have authority to evaluate and sign on for these types of services and have approval from a budgetary standpoint where they can kind of make these decisions. From a channel partnership standpoint, as I said, these are just a couple of examples of other players in the healthcare industry where we could work complementary with them, either to support clients they already have or to go into a client together to kind of make a pitch. And so we've got the EHRs. As we said, even the large ones don't offer this type of service in a way that optimizes the scoring and therefore the reimbursements, for their clients. And there are literally thousands of EHRs out there, some specialties, some general practice ones, and so forth. So getting an introduction to the appropriate senior level folks at an EHR would be a great opportunity. So another way to think about it. As though many of you are here, obviously understand the healthcare industry, there are a lot of other services, what we'll call sort of the back office functionalities of a practice that are being outsourced. One of those are primarily to what are known as a revenue cycle management company who handles billing and coding and other services for the healthcare organization. We work with many different RCM companies, and so introductions to those folks would also be appropriate. And then we do find that there are a lot of consultants out there, and the role we can play with those consulting partners very simply is that our expertise is in the data extraction, data analytics, and presenting that data in a way that it becomes very identifiable but useful relative to being able to focus on various compliance or quality initiatives that a consulting organization may have engaged with a client to provide. And so we can do the back end heavy lifting of the data side of it and automate it with software rather than having to throw human hours at it to be able to do that. So what's the opportunity here? Our hope is that we've intrigued you enough that you want to continue to have a conversation and an interest in leveraging your network to support our business development efforts, right? We're looking for an opportunity to get in front of the key decision makers at healthcare organizations or other entities selling services and products into healthcare organizations to be able to present our services and the solutions and value we can bring to that organization. And so what we have set up through a link is we've got sales materials ready to go to support your efforts. If you identify, who in your network you think would be a good opportunity and make that appropriate introduction through our lead generation form, which again is a part of our the Patina Nation specific element to our website. And then if we sign one of your referrals on as a client and so forth, you'll get compensated accordingly for that effort to have made that particular introduction. And so the process here, just so everybody kind of has a sense for that, is hopefully you're thinking about who, we've got the materials ready to support your efforts. You take the lead in terms of making that introduction, pass that lead over to us. Our team will run point relative to engaging with the prospect, educating them on who we are, what we do, and the value we can bring to their organization, including a very strong ROI analysis that we incorporate into all of our presentations to them. And then if we sign, you'll benefit through the referral fees you'll earn as a result of that. And so the compensation that we've agreed to and worked through with our partners here at Patina very simply is a referral fee as being a partner of ours of 10% associated with the first year of the contract fees, and then 5% of the second year contract fees. Our hope when we go into a healthcare organization is to sign them for multiple years. They understand and see the value of our organization. And if that relationship continues, we want you to benefit, from that as well. And so we recognize too that the sales cycle isn't going to be a one call and the sale is closed. And so the opportunity to earn that referral fee is there for 6 months, a 6-month tail from the time we make the introduction and engage with that client to see whether or not there's an interest in our service. And so how does one get started? As we said, we've got a landing page here with some more information. We at Healthy Filings are very happy to take additional calls on a one-on-one basis to get into more detail here and to talk through with you who within your network you think might be a good fit or appropriate for this. But by going to healthyfilings.com/patina, there's some additional information there. There's the sales and marketing materials that we talked about that would be available to you. And then ultimately by contacting us, that is the best way to kind of initiate the process. So with that, I know I covered a lot fairly quickly. I think our objective very simply was sort of a high level introduction and to look to engage. And we wanted to leave plenty of time here for questions. As we know, your questions will help us to continue to refine what's important to you. So Sarah, do we have
Great.
Jesse? Yep.
And then Sarah from Healthy Filings is going to be helping us with Q&A today.
Great. Well, thank you, Robert. And the questions are coming in. The first one, doesn't an EHR like Epic or Cerner provide a comparable service?
Yeah, really good question. And so the most direct answer is no and yes. So an EHR like Epic or Cerner will have certain report functionality available through their EHR platform. But there are two distinct differences between what they offer and then what we do, which is the first is their reports tend to be static reports and don't allow one to drill down to the level of specificity that we're offering here, which is to see not only the discrete measure definition, but exactly what patient and what within that patient record or chart may or may not have been addressed by the clinician when the clinician engaged them, and therefore making that more actionable. The second fundamental difference here is that their reports are in isolation. What becomes important here again is not the absolute performance, but the relative performance. And so being able to benchmark against your peers continuously throughout the year to know how you're doing becomes critically important to being able to know how to optimize your performance and score under the nature of this program. And that is not something that any of the EHRs are able to offer. If they talk about benchmarking, they're oftentimes referring to a benchmarking within the other users of their EHR, which is completely irrelevant because that's not how CMS looks at, tracks, and ultimately determines how to score a particular provider based on the measure and information that they're submitting.
Okay, thank you. The next question, is there a particular type of organizational structure or size that becomes a determining factor in terms of who makes the best target prospect?
Yeah, good question. So here's how we sort of address that, which is any clinician that is engaging a patient who's on Medicare and they're billing Medicare for those services, they need to understand, focus on, and comply with these types of programs because there is no difference between size, specialty, location, structure, public or private, that makes a difference in terms of the nature of the program and what they need to do to score well under the program, and then the correlation back to their reimbursements. And so for the Patina Nation members that are out there, whether it be a small independent practice or a very large publicly traded health system, they all need to be thinking about and focused on this. And that's where and how we can engage to add value and importantly impact their bottom line.
Got it. The next question, who is the best contact to approach for an introduction?
Yeah, good question. It varies or depends, again, on the size most often of the organization. For a smaller, medium-sized independent practice, sometimes it's the practice manager, sometimes it's the clinician or provider, who owns the practice would be the right introduction in. If it's a larger organization, we actually encourage and recommend making introductions into multiple people because it's not always clear where responsibility for this may fall. Because of the financial implications, it may fall under the CFO. Because it's all about improving the quality of care and improving outcomes, it could be the CMO. Sometimes medium or large organizations actually have a department a quality department, or a compliance department that might be on point for these types of things. So, but oftentimes with the larger organizations, it isn't just one individual who's perhaps making the decision, and multiple departments will get involved. And so the more individuals within the larger organization we can talk to and engage, the better off we're going to be in terms of success in ultimately being able to secure them as a client.
What EHRs have you worked with, and how do you validate the data?
Good question. So as I said up front, just to confirm, we're Switzerland. As long as the EHR is certified, we can perform our services. We've integrated with over 80 different EHRs to date. I can't name them all, but just to give you an example, Epic, Cerner, eClinicalWorks, Allscripts, Centricity, Greenway, and the list goes on. So we've integrated, fair to say, with all of the major EHRs. We have clients on all of the major EHRs that we're providing these services for. And then we have a number of specialty EHRs. The way we validate the data and the data integrity, and that's again where our classification as a cert, and then our ONC certification for our software, that's where the data validation comes in. So what we do very simply is we'll go into the EHR. We don't rely on any of the reporting functionality of the EHR. We'll do a raw data extract through the integration that we've built and we control into our own data warehouse. And that's where we do all the data manipulation, data analysis, measure calculation, and ultimately package that up into an electronic file for them to be used and viewed via the dashboard and are ultimately submitted to CMS. The data validation and data integrity element of it is what the ONC certification is all about. So when I say that that's what we provide, the ONC is verified and certified that data integrity.
Okay, thank you. How do you approach quoting in engagement?
Good question. First, we custom quote every opportunity because no two clients are alike in terms of their needs and how we might approach this for them. But generally, the way we approach the quoting is once we understand the organization's objective, number of clinicians, number of EHRs in which data needs to be pulled, will they just use the annual reporting service versus the ongoing web-based dashboard for purposes of being proactive, we then get in and quote them accordingly. We quote based on one or two fundamentals. There'll either be an annual enterprise fee for the services, or sometimes we will quote on a per clinician, per reporting period basis to kind of variabilize it that way, especially for organizations that are growing either through just natural growth or through acquisition. It tends to be a little more beneficial to everybody to quote that literally on a per clinician basis. But we will custom quote each based on the objectives we're trying to achieve, the length of the initial service agreement, and various elements like that.
Do you have any ROI benchmarks you can share about the value you have produced for clients to date?
We certainly have what we'll call case studies, and we'd be happy to have those discussions, with you on a one-on-one basis, depending on the particulars. Generally, we look at it two ways. We look at it on A, how many points were we able to earn them, and we know points equal reimbursements. And then B, through an ROI analysis of, based on their annual Medicare reimbursements, based on how many points they could or could not have earned, what we earned for them, penalty avoidance, et cetera, what the impact is on the bottom line, and happy to get into more detail on a one-on-one basis. And if that becomes an element to an introduction, we're happy to be able to talk that through pretty thoroughly.
In what regional areas do you market and serve?
Yeah, another good question. The beauty of software and cloud-based software is we have no constraints. So any US-based health system that is seeing Medicare patients and billing Medicare is a prospective client for us. And so there's no geographical constraints. We've got clients from coast to coast. We have clients in Hawaii. We have clients in Puerto Rico. So,
Robert, what kind of resources are needed from the client relative to implementation of the services?
Yeah, that's a really good question. I'm glad somebody brought that up. The short answer is none. We are meant to be a complete turnkey outsourced solution for purposes of the ongoing tracking, measuring, and then submission of this quality data that is required by CMS. And so there's no IT resources because our software engineers will build the bridge between our software platform and their EHR. There's no administrative resources because, again, our implementation team and our operations team is doing all the data extraction, measure calculation, and then literally pushing out the dashboard to the client. And so we don't need to A, be on site. It's all done remotely. B, we don't need any resources from the client. And so that's part of what we talk about both in the ROI as well as generally speaking. We free up resources, whether it be administrative resources or the clinicians themselves, so they can focus on what they want and need to do best, which is patient engagement.
So we've gotten a number of questions sort of around this same subject, sort of phrased in another way. What's the client's expectation as the number of FTEs necessary to add or augment when implementing the program?
Yeah, really good. We actually hope that they can reassign FTEs to other initiatives and other programs rather than having them focused on data extraction, chart abstraction, measure calculation, report running, and or trying to generate reports and then analyzing those reports. We free up all those resources so they can then take the information and use it rather than just trying to get the information. And that's kind of the value that we bring within the partnership. And so back to the QM Accelerator, that web-based dashboard and so forth, we'll train whoever they want to be a user of that. But our training sessions literally are 30 minutes to teach somebody on the client side how to use and engage with the dashboard to get A, the reports, and B, the critical data they need to make it actionable. I hope what you saw in a quick 7-minute demo was that with quick clicks, you're from the organization level down to the individual provider level, right down to the individual patient level with a level of detail about that patient to then make it actionable.
Great, thanks. Another question, do you integrate with PCC?
I will apologize here. This industry is fraught with acronyms. I'm not sure if somebody's referring to a specific EHR, a specific program. And, so whoever asked that question, if you could tell us what PCC is,
yes.
I'll know whether you're talking about an EHR, a program, or what.
Click care.
Oh, yeah, the answer is yes. So, all right, thank you. I apologize. But yeah, the answer is yes. And we understand that exceptionally well and the value of that, and would be more than happy to spend some more time talking about that.
Great, thank you.
I also saw a question just real quickly about ACOs. Yes, so that's a really good question. There are 3 different types of ACOs, track 1, track 2, and track 3. Of all the ACOs out there, 93% of them are track 1 ACOs. Track 1 ACOs are required to comply with MIPS. They have to comply a bit differently. There are different measures, but they are not exempt from having to have to comply with MIPS. And so, yes, we have many clients that are ACOs or parts of ACOs in which we're providing services because they, like everybody else, their reimbursements are tied to compliance and points earned.
Okay.
And we have time for one more question.
All right. Well, it's hard to select. How about, can you talk about how long does it take from the time of signing a contract to the go live?
Yeah, that's a really good question.
Okay, and maybe I'll add in a follow-up because that will be part of one question, is then how and when is a client charged for the services?
Fair enough. So generally speaking, we can bring a client live in 4 to 6 weeks. If it's an EHR that we've already integrated in, now no 2 versions are necessarily alike, so I call it, we've carried the ball to the 5-yard line, and the last 5 yards across the goal line is where there tends to be some additional implementation work. But generally speaking, within 4 to 6 weeks of engaging with a client, signing a client, we can have them live and up and running on the dashboard. And so that's another good question. The way we ultimately bill, whether it be a group enterprise fee or per clinician fee, the bottom line is that we bill on a quarterly basis for the clients. So we bill for the upcoming quarter based on the structure of the contractual arrangements, with the client.
Great. And thank you, Robert, for joining us today. This has been very interesting. For all of you from Patina Nation, thank you. And if you'd like to leverage your network to support the Health eFilings business development efforts, you can visit healthefilings.com/patina. You'll be receiving a post-event survey in your inbox momentarily, and we ask that you fill that out. Helps us plan for future events. And then visit patinanation.com for more of our offerings and upcoming events. And then to learn more or talk about earning opportunities, feel free to reach out to Robert at healthefilings.com/patina. Thank you all for joining us and have a great day.
This has been a presentation of the Patina Nation. To watch more content like this or for more information, please visit us online at www.patinanation.com.